ladies and gentlemen, and it's my honor and pleasure to have a talk about secondary prevention of oral cancer, the Mucosal screening program in Taiwan. Yeah. First of all, I want to introduce my hospital. It's located in southern part of Taiwan, and currently we have 2,700 beds available. And nothing to disclose. And this figure shows that the trend of the instance of the upper aerodigestive tract cancer in Taiwan. We can see that oral cancer is increasing in recent years. And in my hospital, we must treat the Betel-related head cancer up to 400 per year. It's a tremendous burden. And the clinical stage distribution of oral cancer in Taiwan, in 2011, we can see that up to 58% in late stage. And in my department, we can see that more than 62% in the late stage. And the trend of the long-term incidence of oral cancer is still rising, especially in the male. And why? Because they have the habits of the smoking, bitter nut chewing, and even the drinking. And we can see that the age standard rates per 100,000 up to 31. It's very high. And the patient died of oral cancer actually is increasing in recent years. And the age standard rate per 100,000 is up to 10.36. And they look at the IRC, the data, and we can see that in Taiwan, we have a male, a total number exceeds 4,700, and the SR will reach 31. I think it's the #1 in the world. And how about the female? I think the instance is not so bad. It's, the ESR only 3.23. How about the mortality rate? And I think this data show that we are the #3 in the world. It's reached SR over 10. How about female? I think it's not so bad. It's just only 0.074. And this is the recent published the study, and come from Taiwan. It's a very longitudinal study, and they recruit a lot of the population, and the follow-up up to 18 years. And those patients who have used bitter nut with a high instance of developing the oral cancer when compared with the non-user. And the hazard ratio up to 5.77. And how about the impact of a cigarette? It's not so high, but it's around 2 of the hazard ratio. This is another a paper come from Taiwan, and this is a cross-sectional study, and they show that if the patient have the history of alcohol drinking, bitter nut chewing, and smoking, they will have about 123-fold risk when compared to those patients without any bad habit. Why the prevalence rate of oral cancer is high in Taiwan? I think it is traditionally. in the 7th century in Taiwan, we had Aboriginal people, and actually they liked chewing the bitter nut. Even nowadays, they worship their ancestors with the bitter nut in a special occasion. Yeah. Our government always persuade our people to keep away from the bitter nut chewing. However, there are a lot of the bitter nut vendors, especially along the way to my hospital. And even in my hospital, they had bitter nut standing in the floor. Yeah. Okay. Please. Next slide, please. Okay. Even the patient who visit your clinic, it's not rare. Yeah, they will chew the bitter nut. You can have bitter nut in the oral cavity and the bitter nut standing in the oral cavity. And even this patient have a soft palate cancer, he's still chewing the bitter nut. And slide video clip right here, left side. And this patient who visits my office and he just chewed the bitter nut 10 minutes ago. We can see that the lot of the bitter nut standing over the oral cavity. And right video clip, please. This is the same patient. We can see that even the hypopharynx and the epiglottis, tongue base all have the staining of the bitter nut juice. And actually, in this patient, we will develop the aerodigestive tract cancer. We will show a very extensive field canceration among this group. Let's talk about the oral screen. In the pilot oral screen, it happened in 1998 in Taipei City. Over 8,000 participants, and the target population would be the men with the habit of chewing bitter nut. But most of the group come from the laborers, and this job was done by the dentist. And we can see that they just find around 40% of patients with the precancer lesion. And in Taiwan, we started a nationwide oral mucosal screening program. Just from the 2010, it's just one part of project for upgrading of cancer care by Ministry of Health and Welfare. We include 4 cancers, colon cancer, breast cancer, cervical cancer, and the oral cancer for the massive screening from the general population. In oral cancer, those who are over 30 years old and a heavy history of smoking or bitter nut chewing is advised to be subject to this screening program. At first, we should have a training about the general practitioner, even a dentist or the ENT doctor, and let them learn about what is the precancer or the cancer lesion in the oral cavity. And the second step that we build up our data management system and recruit the case manager. And then we start our screening program and aiming at the high-risk group over 30 years old and history of smoking or bitter nut chewing. And if they have any positive finding in the oral cavity, it should be referred to the second or tertiary referral center within 2 months. And the physician who checked the patient, who should fill out the mucosa screening sheet. And if we define the precancer lesion is just these items and by direct vision. And in Taiwan, I think everybody is covered by national health insurance, and everybody will have a IC card. So after the complete oral screen sheet, and the case manager will submit the data to the National Health Data Center. And let's look at the flowchart of past finding. These people should have a second look in the referred hospital within 2 months. But if the patient escapes, the case manager should intensive follow-up, persuade them to have a look in the hospital. If it is normal, we should give them the health education and a follow-up every 2 years. But it is a past finding in the oral cavity, we should perform biopsy if it is necessary. This is the result of the oral screening in Taiwan. And annually, we screen 400,000 people, and currently we can find about 1,000 newly developed oral cavity cancer. And the mucosal positive rate, I mean maybe the precancer cancer, is around 11%, and the referral rate is around 79%, and totally we can find about 0.33% of oral cancer, and about 1/3 is around early cancer. And we can look at the figures that the newly developed of the oral cancer could be found from the screening program is from the 25% to 31%. This is our screening status in my hospital, and the mucosal positive finding is up to 18%, and the oral cancer finding will be more higher to 0.041%, and the early stage cancer is around 45.6% in this group. I think this is a previous oral screening program in Asia, and the mucosal positive rate is up to 16%, but actually we can find less than the 0.001% of oral cancer. I think in the future, I hope our government could provide more funding to do more. Yeah, and maybe we can perform maybe the torrent blue, virus staining, or the currently we develop the cellular biomarker screening, or we could use the oral brush biopsy or cytology to find more early cancer. Conclusion, I think this screening program in Taiwan, I think is effective and efficient in the secondary prevention of oral cancer. More than 1/4 of newly diagnosed oral cancer could be discovered in this screening program, but less than half of the patient is in the early stage. I think more health education is necessary to enroll more patients in this screening program to find more early cancer. Thank you for your attention.